The Diamond program is the first of its kind, an eye drop for the treatment of DME. The fact that they don't need to come back every month for an injection and they can instill the drop in the comfort of their own home is a great appealing factor for patients.
We're back at Eyecelerator alongside Arvo here in Deer Valley. Sharon, you are the CDO of Oculis. There's a lot of cool stuff going on there. Glad to have you here with us.
Thank you very much.
Tell me a little bit about what you're doing today, though, here at Eyecelerator.
I'm presenting the company, and the most exciting thing about what we're doing right now is we are completing phase 3 study enrollment and getting ready for the top-line tables in the second quarter of next year. And we're positioned to potentially launch it in 2027.
You know, that's fascinating because I know anti-VEGF with the needle gets back there to do its thing, but to think that an eye drop can penetrate, that's just futuristic, so well done. What are some other challenges technically that you're facing?
Yeah, the challenge with an eye drop is really twofold. Number one, it's the residence time on the eye surface because it's going to be washed out really quickly. And the second thing is how does it go through the tear film? And our proprietary technology with Optireach is able to overcome those two obstacles with the gamma cyclodextrin that is lipophilic or with a hydrophilic external surface and the adherence to the mucin layer. It's increasing the residence time and allowing dexamethasone to go all the way to the back of the eye.
So Sharon, I noticed that the patient enrollment was really quick. What do you attribute that to?
Yeah, the sites that we selected are highly experienced and they have the patient population. We enrolled both naive patients and previously treated patients who are inadequately responsive to anti-VEGF.
Patients that are needle averse too, I would imagine.
Correct. And everybody is really excited about the prospect of an early intervention.
Also, I'd like to know a little bit more about the market for this drop.
We see it really in two segments. So the first segment are those patients who are diagnosed with DME but are not yet treated. So those who are injection averse, for example, or would like to defer the injection to when they're absolutely necessary. They can start off with an eye drop and start in the comfort of their own home and perhaps defer the anti-VEGF for a later date. And the other segment are those patients who are inadequately responsive to anti-VEGF and current therapies. And here we can supplement them with an eye drop or perhaps increase the time between injections.
Can you tell us a little bit more about your pipeline, by the way?
Absolutely. So outside of the DME program, we have two very exciting programs. One in dry eye disease where we are able to do precision medicine. We look at a genotyping of the population, and we have seen in previous studies where a certain genotype has better efficacy and better response to the drug. And the other program that we're working on is the OCS-05 in neuroprotection, and that's extremely exciting to the field as it's first of its kind to show both structure and functional improvement in acute optic neuritis.
So I'm trying to understand sort of the USP of Oculis overall. Is it more about the delivery vehicles which you're creating that, allow such things as penetration or other things?
Yeah, that's a good question. So it's not just about the delivery, it's about the assets that we have and how we are just taking forward. The OCS-05, for example, is not an eye drop, obviously is currently an infusion. The dry eye is an eye drop, and OCS-01 for a Diamond for DME is an eye drop. We are an ophthalmic company and now neuro-ophthalmic, and perhaps in the future, neurology indications are in store for us.
Yeah, we've met a number of companies here today that have indications that are almost starting in ophthalmology, but have applications across subspecialties. So what starts in the eye has dramatic implications elsewhere, no?
Exactly right.
Great. Well, thanks for spending a little time with us today. It's been great to be out here at Arvo for sure and meeting such interesting people and products as you have going on.
Thank you very much. Thank you for having me.
Cheers.